Today on Cancer Buzz, special post-pandemic considerations for patients with chronic lymphocytic leukemia, or CLL. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. The new post-pandemic normal is changing the way we work with our patients, especially those who are immunocompromised and highly susceptible to COVID. This all means it's even more important to employ shared decision-making. We asked our guest today to tell us how care teams can incorporate shared decision-making into patient conversations. Dr. Brian Koffman is the co-founder, executive vice president, and chief medical officer at the CLL Society.
The COVID-19 pandemic had a profound effect on the CLL community. Many patients with CLL had to struggle with issues in terms of their treatment, when to decide about treatment, which treatment to have, but generally led a relatively normal life. But the pandemic forced into the spotlight the reality that all CLL patients, regardless of their treatment status, even those who've never been treated, are immunocompromised. And patients had to make radical shifts in terms of their lifestyle. For a lot of patients, that meant being locked down, that every time that they went outside, every visit to the doctor, every visit to the grocery store was a high-risk encounter associated with a significant risk of getting very sick or even dying because the early mortality rates and morbidity rates were so high for the immunocompromised.
Dr. Koffman, why is it so important to use shared decision-making when working with this patient population?
In some disease states, there is a very clear pathway to how to appropriately treat the problem. For example, if someone comes in with a strep throat, the patient either gets penicillin, unless they're allergic to penicillin, they get an alternative. But in CLL, there are so many excellent therapies to choose from, and all of them carry their benefits and their associated risks. So patients need to be involved in those decisions because it's not just what's the best therapy, but what's the best therapy for the patient themselves. What other illnesses do they have? Do they have heart problems? Are there financial issues involved? Is it difficult for them to get to the hospital? Would an oral therapy be preferred over an IV therapy? Is once a day preferable to twice a day? Is something that you only take for a year or two better than something that's ongoing? Or is the most important thing the efficacy of the therapy? How long will I get a remission? How long will I survive with this therapy compared to another therapy? All of these are decisions that need to be shared between the doctor and the patient. The doctor cannot begin to assume that he or she knows what the patient in front of him is preferring when making those decisions. That's why shared decision-making is the cornerstone of all decisions in CLL.
What are some best practices that listeners can take away and implement in their own practices?
When in the room with the patient and considering what option is ahead, and that may be a treatment decision, it may be a testing decision, the doctor or the healthcare provider brings with them the knowledge of what those risks and benefits are to each potential option. The patient brings what's important to them, what they're thinking about. So generally, it's important to listen to the patient, see what they're looking for, bring the information, and also be aware that nowadays there's often a third person in that room, and that person is the internet. Patients are finding stuff online, some of which is excellent material, and a lot of which is suspect. And it's going to be the role of the healthcare provider to help the patient understand that some of the data they're getting will help inform their decision and may even be new to the healthcare provider. But much of it may not be valid and scientifically rigorous enough to be considered helpful in making a shared decision.
Are there any challenges that come with recommending patients get those vaccines and boosters?
I think that there's a significant vaccine fatigue among patients. And this fatigue is different in the immunocompromised community because it's very hard to get a patient hyped up when they said, but I didn't respond to the first vaccine. I didn't respond to the second dose of the vaccine. What makes you think I'm going to respond to a fourth dose? But there are data that shows that patients' response rates go up. That's why the primary series in the immunocompromised is 3 shots rather than 2 as it is for the immunocompetent. And there is evidence, at least across the broad population, that people who've had the bivalent, the newest booster shot, do better in terms of infections with the Omicron variant, probably including the most recent Omicron variants, such as XBB variants.
What should patients keep in mind?
I think it's important that CLL patients realize that the pandemic isn't over for the immunocompromised, and that SARS-CoV-2, the virus that causes COVID-19 infections, is not going away. There is never going to be a time that it's going to be 100% safe to get back in the water. And patients have to start looking at their risk-benefit ratios in terms of what are they willing to do.
You can head to the show notes to find more information about shared decision-making and more resources on treating patients with CLL in the new normal. Until next time, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.